eye is suitable to go in for microsurgery, which is phacoemulsification. Sugar levels are under control, so all the lab tests are done, and we do a CBC, that is a complete blood count. So to remove the patch, they will come in the next day, and then the 5th day, and then on the 20th day, Hi, I'm Dr. Susan Vargese, Director of Smart Vision Hospital. If you have seen my previous video, I spoke about what cataract is. So cataract surgery, when we come to most patients who come in to the doctor, to the ophthalmologist for cataract surgery, they don't know what exactly it entails. So as soon as you come in, we check the vision, we check the eye pressure, we check the duct syringing, and then we see whether the eye is suitable to go in for microsurgery, which is phacoemulsification. Of course, over the years, the techniques have improved so much that we now have the latest of techniques which are available. Many people call it laser surgery for cataract, but mainly what is being done is it is high frequency ultrasonic energy which is used to phacoemulsify the cataract and suck it out through a very fine tube. And then after that, a foldable lens is implanted into the capsular bag. So this procedure is, though it sounds very complicated, it can be done within 10 minutes in the experienced hands of the phacosurgeon. So before that, we need to see, first of all, whether the sugar levels are under control. So all the lab tests are done, and we do a CBC, that is a complete blood count. We see whether the patient's having any infection. And then following that, we will do a few other tests, and we do an A scan. So that will tell us what is the power of the lens that we have to implant into the eye. Of course, if it is a mature cataract, so usually we prefer to do the cataract surgery in the immature stage, or that is unripe stage. But when it becomes ripened, or it is very mature, that we are not able to examine the retina of the eye, we need to do a scan called a B scan. So once that scan is also done, then we know exactly what the back of the eye, that is the retina, looks like, because the cataract is totally obstructing the view of the retina. So once the B scan is also done and the A scan, we know what is the power of the lens, we know how the blood conditioned blood parameters are, and then of course all the other eye local examinations that are done, that is the intraocular pressure, which we do with the applanation tonometry, and the duct syringing. Then we are all set to go, and we give the patient some preoperative drops, antibiotic drops, and NSAID drops or NSAID drops, which will prevent the pupil, which will be dilated during the surgery, from constricting. So we give both these drops, and then on the day of the surgery, we tell the patient to put dilating drops every 10 to 15 minutes before they come in for the surgery. Of course, when they come in for the surgery and the pupil is fully dilated, then we have easy access to go in for the surgery. The patient will be taken into the operation theatre. A small local anesthesia prick will be given, or drops, whereby the patient will have no pain at all. So it's a totally painless procedure, and once he is inside or she is inside, the procedure itself will just take 10 to 15 minutes, and then she will be wheeled out, and maybe a recovery period of about 1 hour is all that we tell the patient to be in the inpatient ward, and then they can leave back to their house, and then they need to come in the next day for the removal of the patch. We would have put a patch to cover the eye. So to remove the patch, they will come in the next day, and then the 5th day, and then on the 20th day, we do give them the glasses. Now, if we are putting only a monofocal lens, if we are putting a multifocal lens, that is even better. We do usually one eye followed by the other eye. So both eyes will have total binocular vision, and that will be better for the eye, so that the patient does not develop double vision. And one eye followed by the other, and then following that, both eyes are done. They will have absolute clarity of vision if they have done a multifocal lens implant. So these are all the things that you need to know about cataract surgery.